Good afternoon, everyone. Hope everyone's fine. Today, I came up with the next part of the previous session that I was talking about related to the national immunization or what are all the programs which came under the national programs for children. And today, I'm dealing one of the most important programs which are coming under the national programs of the children. That is the nutritional programs. So we'll be talking about the nutritional programs in our country, India, which are dealing with the children. Before moving to the programs, I would like to ask you what you know about the nutrition, or what do you mean by the nutrition? Or I can say, what do you understand by the name nutrition? Yes? Okay. The nutrition, it's a process of providing, or I can say obtaining the food which is necessary for the health, or which is necessary for the growth and development. Whatever you obtain, whatever you take, I mean, in the form of food, which is necessary for your growth and development, which is necessary to maintain your health, right? So according to the World Health Organization, if I'll tell you what nutrition is, it's the process of taking food and using it for the growth, metabolism and repair. The process of taking food, what you are taking the food, and it is used for your health purpose, it's used for your growth, as well as it's used for your repair and metabolism. So the stages will be like the nutrition states will be the ingestion, then it will be there will be digestion, absorption, then transport, assimilation, as well as the excretion. These all come under the stages of this nutrition. So by this name nutrition, you have to understand that what obtains for the the optimum health, what obtains for grasping the nutritional values for the growth and development, right? Okay, just tell me why this nutrition is necessary, or you can say why it has to be achieved. Why do you need nutrition? For what purpose you need nutrition? I'll tell you the nutritional importance, why it's necessary, and why we are achieving this nutrition, right? Okay, I'll mention that healthy diet, everyone will prefer, even you will be preferring the nutritional diet, or we can say the balanced diet, right? So for your growth, for your living, you are using the diet which is full of nutrients, which is, we call it as healthy or balanced diet. A healthy diet throughout the life, it promotes your healthy, the lifestyle, in case of the pregnancy outcomes, as well as it supports the normal growth, and it helps in the development and the aging, and also it maintains a healthy body weight, and it reduces the risk of the chronic diseases, which are all leading to the overall health problems, or I can say that overall it manages a well-being of a person, right? What do you understand why this nutrition is important? For what reason you are maintaining this nutritional level or nutritional value? It's because you want to maintain your health, you want to have a good growth and development, and as well as you want to enjoy your life in a healthy way, as well as being free from all kind of chronic diseases, which are leading to deaths, or which are leading to various problems of a person, fine. This programs, if we will talk about regarding the programs, there are various programs under this the term nutritional programs in India since first 5-year plan period. During that first 5-year plan period, these various programs are these are running throughout the India. For what purpose? The same purpose, to improve and restore the health states of the vulnerable population. Who is vulnerable people? Who are vulnerable people, and who is vulnerable population? Obviously, the children, they are at the first level, they are coming at the first priority when we talk about the vulnerable groups. So the groups related to the vulnerables, or I can say the vulnerable group, comes for the children, and as well as the pregnant women, and as well as the nursing women, right? So for these nutritional programs are being run throughout this country to improve their overall health. International agencies like World Health Organization, WHO, UNICEF, as well as other assisting, the agencies which are helping in these programs in India to improve the nutrition of the people with a special emphasis on mother as well as the children. So the both target people, it's mother as well as the child, who are going to be taken care throughout these programs. I'll be listing out some of the the nutritional programs which I am talking about today. So the list of them is like a vitamin A prophylaxis program, then the prophylaxis against the nutritional anemia, control of iodine deficiency disorder. Then next comes special nutrition program. Then next comes the Balwadi nutrition program, and there is ICDS, which is Integrated Child Development Sub Scheme. Then comes the midday meal program. These all are coming under the main term, that is nutritional program, and I will be dealing with such kind of programs in this session. Fine. Let's move one by one. The first one I'll be talking about is vitamin A prophylaxis program. Yes. Tell me, what do you know about the vitamin A? What is vitamin A? Before going to the program, we should be knowing that for what purpose this program is made, and it is on what basis, and the objectives and other things will be same, right? So vitamin A, it's a fat soluble vitamin which is usually required for the vision, for the repair, and for the reproduction, and for the growth and development, and many more things, right? So this vitamin A, it has a vital role in your vision, in your growth and development and other things, and it also maintains the integrity of the skin, the mucous membranes of conjunctiva as well, right? So you can guess, you can have a vision over this, that this vitamin A deficiency, it leads to what are all the things. So by seeing its importance, then you can imagine, you can see the things. It is like if there is any deficiency of vitamin A, how it leads. This vitamin A deficiency, it's the most common cause of preventable blindness in the children, and this vitamin A deficiency causes estimate of at least 60,000 children in India which are going to blind with the cause of this vitamin A deficiency each year. So each year 60,000 children are being estimated under this vitamin A deficiency, right? Okay. For this vitamin A, if we came to know this vitamin A deficiency, then the vitamin A should be included in your diet. This vitamin A should be supplemented. It should be included in your lifestyle. And this vitamin A, the sources I'll be telling where you can get the vitamin A. This vitamin A is usually, it is available in the animal foods, and it is available in the vegetarian, foods as well. In the animal foods, you can find it out, as a retinol, like in the meat, liver. You can find it in egg yolk. You can find it in fish, cheese, ghee, butter, and all those things. And if I'll tell you, as in the vegetable sources, as a B carotene, like you can find it in the green leafy vegetables like spinach, amanat, and also in the yellow fruits, mango, orange, and palm oil, as well as in the carrot. So if you know the sources of vitamin A, easily you can grab, you can find out, and you can have an access towards the vitamin A to prevent such kind of deficiency. And it will help you prevent not even the deficiency, it will lead a healthy life too. We'll be moving to the main point, that is the program. So this program was launched by Ministry of Health of Family Welfare in 1970. In 1970, this was being inculcated throughout the country, and the estimate is that there are 12.5 million blind persons in India, according to the census, according to the estimation. So there is 12.5 million blind people in the country. The age group of eligible children for coverage was restricted to 9 months to 30 months of age. So the restricted age is 9 months to 36 months of age. Fine. Okay, next we'll see what is the aim of this program. This program is having an aim to prevent the nutritional blindness, which is due to the keratomalacia. Keratomalacia is one of the eye disease, which is the leading cause for the blindness. This eye condition, in which the cornea of of the eye, which is the clear part of an eye, it becomes soft and it becomes the cloudy, so the vision gets altered. So what it leads to, obviously, to the blindness. So it has an aim to get rid of that blindness due to keratomalacia, as well as controlling the blindness throughout the country, overall blindness throughout the country. Next, we will move to the objectives. We'll find out what are all the objectives under this program. First of all, the main objective and the focused objective is to prevent the vitamin A deficiency. Vitamin A deficiency has to be prevented. How it is to be prevented? By promoting the consumption of vitamin A, as I mentioned in the sources, from the vitamin A rich foods, and by the pregnant women as well as the lactating mother, and under 5 children, they should be knowing, they should be having an information, they should be having an access towards the sources of vitamin A. Then we can prevent it by creating the awareness among the family. We can prevent it by providing the information dissemination towards the society as well as to the family members, and we have to explain regarding the the importance of vitamin A as well as the prevention of vitamin A deficiency. And next we'll see the next objective for this. The children who are suffering from the xerophthalmia, that's again one of the eye condition. It is the progressive eye disease condition in which there will be dryness over the conjunctiva as well as to the what we say, that cornea of the eye. The cornea and the conjunctiva of the eye will be dry, and due to that it will lead to the blindness, and the people will suffer from blindness, and they are to be treated at health facilities at the priority basis, and as well as the the treatment has to be done for all people having such kind of eye diseases. Fine. Then the children having meals to be given, the children who are having the measles, the children who are having the measles, they should be given 1 dose of vitamin A. And if they have not received in the previously, if they have not received the vitamin A, then the children having measles, they can have the vitamin A dose also. Next objective for this is that all cases of severe malnutrition, the children who are coming under the malnutrition, they should be given additional doses of vitamin A. So mainly for vitamin A doses, given mainly to the children who are having what we say, the measles, as well as who are coming in the malnutrition groups, right? Okay, so by saying the objectives, by mentioning the the target of this one, the program, what do you think? What are all the target group in this program? Yes, it is 6 months to 5 years of children. The children who are coming under the 6 months to 5 years of children, and particularly the children from the areas of rural, some urban slums, or I can mention like the tribal areas, and they should be getting the program services, and these are all the beneficiaries of this program. Fine, you understand? Okay, let's move to the next part. We'll talk about the dose. As the vitamin A deficiency is being prevented, it will be treated with the help of vitamin A. So the dose of vitamin A you should come to know, along with the sources of vitamin A. You should know the dose of vitamin A, right? 9 months to 5 years are given 3 doses of vitamin A. So this target people or the beneficiaries of the group which I mentioned, for them 3 doses of vitamin A is to be given. We'll see the first dose. First dose of 1 lakh international units is to be given for the age group 9 months. 9 months of age has to be given the first dose of 1 lakh international units. The second dose is to be given for the age group of 16 to 18 months. Second dose of 2 lakh international units. Then the interval of 6 months gap up to the 5 years of age, 6 month interval gap will be there. Then a third dose of 2 lakh international unit again for them, by keeping the 6 month gap till they reach the 5 years of age. So what is the dose for them? That means the 3 doses, and in that the first dose of 1 lakh international unit, second dose again the 2 lakh international unit, and third dose 2 lakh international unit for the different age group. Do you get my point? Okay, let's move to the next part. Then the next program which I'll be talking about is the prophylaxis against the nutritional anemia. One of the the leading, I must say, the leading cause of death, because the anemia, you should come to know that what is anemia actually, and the anemia preventions, and also how it is caused, or what deficiency is there for this anemia. Before telling that nutritional deficiency anemia is a common problem among the target group, which I'll tell, and it can occur when the body is not absorbing the the iron. When the body is not absorbing enough iron, when the body is not absorbing enough folate, as well as the vitamin B12 from the diet. That's a problem. That means the body is not absorbing such kind of such kind of nutrients, or such kind of the vitamins which you need for this prevention of anemia. It may be because of any kind of the health condition, or it can be if there is any insufficiency in your body, so, that is leading for the unabsorption of these items like iron, folate, and vitamin B12. So it can be due to the body's own ability, so that they cannot absorb it properly. This anemia, nutritional anemia, it is again a serious concern, as it adversely affects the cognitive, as well as the psychological, as well as the behavioral, as well as the motor development of the child, right? Child, as well as the change of there is a chance of infection if the mother expecting, or the nursing mother, she is having the nutritional anemia. It can have an easy access for her for the infections or for the diseases. The hemoglobin level of the body gives us the indication regarding the anemia, as well as the physical assessment. By the help of the physical assessment, we will be seeing how the anemia patient is like the symptoms of the anemic child, or anemic mother, or anemic women, right? So we can assess by those things, by checking the weight as well as seeing the other symptoms among them. We can find out a person is anemic. Fine. Okay. I'll talk about the program now. This program was launched in 1970 to prevent the nutritional anemia in India in the mothers and the children. Right? Iron deficiency is seen in almost 50% of the children below the 5 years of age, as well as the 50% of the women during their reproductive life. Iron, it's the vital element, or we can say the vital for the formation of the new red blood cells in the body, and hemoglobin, right? So for the hemoglobin, as well as formation of the new red blood cells, the iron has a vital role in the body. Beneficiaries. Guess the beneficiaries now. Yes. Children from 1 to 5 years of age, the pregnant, and the nursing mother. These two are coming under the target group, or we can say the beneficiaries. What next is the objective. Then in objective, what are the things are coming? Assessment of baseline prevalence of what? The nutritional anemia. Assessment of baseline prevalence of nutritional anemia in The people who are coming in the beneficiary, who are they? The children under 5 years of age, as well as the pregnant and the nursing women. Next, objective, to monitor continuously. What we have to monitor continuously? The quality of tablets, distribution, as well as the consumption of supplements. We need to monitor, or under this program, the monitoring and as well as the distribution, and as well as we are observing the consumption of such supplements which are given by this program. Next objective, hemoglobin level of beneficiaries are checked periodically. Time to time, the beneficiary people which I mentioned, for them the hemoglobin level is to be checked, right? Next, motivation to the mothers and children regarding the consumption of tablets through health education. By giving the health education, you can give awareness, you can give information, as well as you can motivate the child as well as the mother for taking tablets, for having an access towards the supplements of iron and folic acids, right? So these things are to be done under this program. Next, we will see what are all the activities, what are all the services which are provided by this program. Fine. The first one we'll see under this program, mainly this program focuses on such kind of interventions like iron and folic acid supplementation in the form of, it can be in the form of tablets, or it can be in the form of what we say, the supplement. It can be in the form of, if there is the solution of iron or solution of folic acids, and it is given to the target people, like mother as well as the children under 5 years of age. Next, promotion of regular consumption of food which is rich in folic acid, which is rich in iron, and I have mentioned the sources of what I mean, that is this one, iron as well as the folic acid. Like the foods rich in this is red meat, fish, then cooked spinach, dark leafy vegetables, then broccoli, stress fruits, as well as avocado, beans, peas, and much more are rich in iron and folic acid. So the consumption of such rich foods should be explained as well as should be promoted for in the regular diet. Next is identification. What do you identify among these target people? It's examination as well as the hemoglobin levels. You have to identify with the help of hemoglobin levels, or with the help of examination. You have to find out, and the treatment is given on the basis of findings on the basis of examination, and severely anemic cases are to be hospitalized or to be given such kind of services which is easily accessible for them, like iron tablets should be included, the supplements, the blood transfusion, as well as the foods which is rich in iron and folic acids. After finishing the activities, after finishing the interventions, we'll come to the dose. What dose, or in what dose you are giving to the child and the mother. The adult woman, she is to be given 60 mg of elemental iron plus 0.5 mg of folic acid. Then for the children, 20 mg, this one, elemental iron plus 0.1 mg folic acids. So this is the dose for them. Then I will move to the next program of this nutritional programs, that is control of iodine deficiency disorders. Iodine deficiency disorders is to be controlled, and for that the program is being launched in this country, that is the control of iodine deficiency disorder. And for this, before going there, you have to come to know what is actually the iodine and what causes the iodine deficiency, right? This iodine is one of the, what we say, the vital element, or I can say the trace element in the body, and it's required like up to 100 to 150 grams should be for the daily requirement in human body, and as well as it helps in the growth and development. And iodine deficiency, it's the most common cause of thyroid enlargement and goiter. Main cause for enlargement of the goiter, you can see what do you mean by goiter. Have you seen the goiter everywhere or anywhere? The, you feel that, or you can see that outgrowth from the neck or from the throat. Sorry, from the throat you can see that outgrowth. It is easily visible, right? So that enlargement and the what I say, the thyroid problems which are due to this iodine deficiency. So iodine deficiency is to be prevented. With the help of this program, we can see what are all the helping services, what are all the what are all the interventions under this program. Patients with a large goiter may experience, if the person or the patient who is already having such kind of enlargement goiters or the thyroid enlargement, they'll be having the symptoms, while having something, they'll be having a swallowing problem, as there will be constriction over the muscles of this one throat, and choking will be there, and especially when lying down, there will be the problem of for breathing, or I can say the breathing difficulties, and there will be swallowing problems, right? So this iodine, it's usually not produced by our body. It has to come from a diet which we are using in the daily basis, and that diet should be having the accurate requirement of this iodine that I mentioned. That's 100 to 150 grams per day for a person. This iodine deficiency usually occurs when there is, the soil is poor in iodine. There is less provision of iodine in the soil, and which is causing the low concentration in foods which are produced, or there will be insufficient iodine intake by the population, and which leads to the iodine deficiency. And then it overall leads to the iodine deficiency disorders like this one, enlargement of the goiter, enlargement of the thyroid problem, and much more. We'll come to the program. The government of India launched this program in 1962 under the National Control Program, and in 1992 it was renamed as National Iodine Deficiency Disorder Control Program. First, it was mentioned as the National Control Program of Iodine, or National Iodine Control Program. Then in 1992, it was renamed with National Iodine Deficiency Disorder Control Program. Right. We'll move to the goals of this program. Under the goals, to reduce the prevalence of iodine deficiency disorders, the goal is to prevent such kind of disorders which are due to the iodine deficiency, like what are all? There is physical, there is mental retardation, there is the deaf will be with the deficiency of iodine, deaf or mutism, abortions, cretinism. All these disorders can come under this diseases or disorders, and this to reduce such kind of disorders below the 10% in the entire country by 2012. We'll come to the objectives of this program. Objectives of this program, in that the first one comes, the replacement of the salt. What salt? That means the common salt or the ordinary salt which the people living in the rurals, slum areas, or as well as the tribal areas, it is to be replaced by iodized salt. Next comes that identification of the goiter. This goiter is to be identified in the areas, and in that areas the iodized salt is also replaced. This iodized salt is to be given instead of the common salt which they are using. Then the laboratory monitoring. For what reasons this the laboratory is monitoring? It is monitoring the content of the iodine, especially in the urine excretion, the content of the iodine salt in the urine, and as well as the isolated salt the content of the isolated salt as well with the help of this program. Then the next objective is the survey to assess the magnitude of iodine deficiency disorder. For that survey has to be made so that it will assess the iodine deficiency disorders. The next comes the health education and the publicity. In every matter or in every condition, giving the education to the people, giving awareness, counseling, or whatever you mean, like imparting any kind of information or disseminating within the people, it has to be there wherever it is, in whatever conditions. So for this also, health education and publicity among the people, awareness among the particular target area, the particular target people, it has to be given regarding what, regarding the the importance of iodine, regarding the prevention of iodine deficiency disorders, having the access to the preventions, having the access to the facilities of the programs for them. Understand? Okay. Next, we'll see the interventions or the activities which are done, which are running under this program. In that, the technical guidance, first one, this technical guidance, under this, the guidance which are given or documented by the authority, by the program itself, or resources in the form of documents, in the form of booklets, or whatever it is to be given to the states as well as to the union territories, right? Then the next is imparting training to whom? To the state health personnel who are all involved in this program. For them, the training should be done, as well as the transmitting the awareness related to the program services. Monitoring and distribution of the iodized salt in states and union territories, the distribution as well as the monitoring, whether the people who are coming under this target, who are coming under this target population, the areas which you are preferring, which you are pointing out, whether they are having access to the services, whether the distribution you are whether the distribution you are going for, it is implementing under this program, and everything should be monitored. The next comes the dissemination of information, education, and communication. This you are circulating, or I can say you are spreading the information to the people under which are coming under this program. Further, you are using the communication channels, you are using the the media mass, whatever you are using for the awareness to the target people, or having the access to the people where they do not know regarding the iodine and iodine deficiency disorders. So these all things are coming under this iodine deficiency disorders, and it should be prevented by following the steps, by following the guidelines of this program. Next, we will move to another program, that is the special nutrition program. Special nutrition program. Under this, I will mention that this program in India was launched in 1970 to 1971 by Ministry of the Social Welfare, in operation in slum areas, tribal areas, and the rural areas. Main target will be under these programs, especially will be slum areas, will be this one, rural as well as the tribal areas. Under that areas, what are all the people coming? Those people have to be given the services under these programs. Then the aim of this program is to improve the nutritional states of the target people. The nutritional status has to be improved, the nutritional diseases, and it should be prevented under this program. So this is the main aim of this program. Next, we'll see objectives. Under objectives, the first one is to provide the supplementary nutrition. The nutrition has to be maintained by giving the supplements as well, supplements of the nutrients, supplements of the vitamins which are all needed for a healthy and the balanced diet. Then to provide a health service including the supply of vitamin A solution, iron and the folic acid. These services, health services should be provided, and it should include the vitamin A as well as it should include the iron and the folic acid supplementation. The beneficiaries of this group are again the children who are below 6 years and expecting and lactating mothers. The services are the activities under this program. The first one is preschool children. The preschool children, they should be given 300 calories and 10 grams of protein for the preschool children, and for expecting and the nursing mothers, the 500 calories and 25 grams of protein. And in this program, the supplement is provided for 300 days in a year. Next program comes Balwari Nutrition Program. This Balwari is the nutritional program for the preschool children. This program was started in December 1970 in India under the Department of Social Welfare through voluntary organizations. The beneficiary group in this program is the preschool children 3 to 5 years of age. Then the services provided by this group are like it provides the 300 kilocalories and 10 grams of protein per child per day. That during 25 days of in a year, they are providing the 300 calories and 10 grams of protein to the preschool children. Not only they are giving the nutrition, they are providing the preschool education as well. Next program under these nutritional programs is ICDS, one of the common and the most important programs, Integrated Child Development Services Scheme. This program was started in 1975 in pursuance of national policy for children. The aim of this program is to provide services to the preschool children in an integral manner to ensure the proper growth as well as to improve the nutritional health in the rural, tribal as well as in the slum areas. The objectives of this program is to improve the nutritional as well as the health states of the children in the age of 3 to 5 years and also 0 to 6 years, and the lay foundation for proper psychological, physical as well as for the development of the child. The next objective of this program is to reduce the mortality and morbidity as well as malnutrition in the school dropouts. Then we will see the beneficiary group. The beneficiary group for them children under 6 years of age and also adolescent girls, then pregnant and lactating mothers. They are the beneficiaries, they are the target people under this program. The objectives of this we have seen. Now we will move to the services of ICDS, the interventions under this program. First one is health checkups. Health checkups under that for mothers, antenatal care is to be given, right? Examinations and this one what we call that as iron and folic acid as well as the protein supplementation, and postnatal care for mother as well as for the newborn, and physical examination for all of them. Then next objective or the service under this, the next service under this ICDS program is immunization. Immunization for children against all vaccine preventable diseases, and mother during the expectancy period related to the tetanus toxoid, 2 doses are to be given, right? Then the supplement or supplementary nutrition for children as well as for the mother, and vitamins, minerals, as well as the iron and folic acid supplementation should be added for them. Early childhood care and the preschool education for them. This program should be given, or the program gives the preschool education as well as the nutritional services to the child under 6 years of age. Then nutrition and health education, again I mentioned that the most important part, it is the education or awareness among the people. So for them, the women under 15 to 45 years especially prioritize, they are to be prioritized, and the nursing and expecting mothers especially during that group, as well as the adolescent girls, they are given awareness regarding the, the special nutrition programs, awareness regarding the nutrients to be added or included in the diet, usual diet or the regular diet. It is done by a anganwadi worker, or during the visits of, antenatals, during the examination or during the immunization. These all things are to be included. The last program we'll be moving, it is the midday meal program. I know that everyone must be getting an idea regarding this midday meal. Maybe most of the children at the schools, they might have seen, or they might have, observed this midday meal program. We can say the lunchtime, right? When we get the midday meal idea, we feel like it's a lunchtime for the children in the school. Yes, this midday meal school is midday meal program is also known as the school lunch program, right? So because it is in schools, obviously they will be giving in the lunch period, they will be giving in the, the break period in the day. This program, it was launched in 1961 throughout the country. It has to be that means from the year 1961 it is to be implemented, or it has been implemented throughout the country. This feeding program is the joint venture of the health and educational department. That means the health as well as the educational department, they both are working collaboratively, and with the help of UNICEF, with the help of CARE, and with the help of other agencies, this program is running, and it is showing the good rates regarding the admissions in the school, regarding the health improvement, regarding the nutritional improvement among the children. Okay, next we'll see the objectives. In the objectives, the first one comes to attract more children for admission, right? So they'll be giving you can think that they are giving us such kind of an attraction, they are giving such kind of feel to come to school. So with the help of this, it improves the admission for the children to school and to retain in the school, to improve the literacy rate, or we can see the education rate, right? The next is the nutritional states improvement in the nutritional states as well as in the nutritional education. Then to ensure the universal primary education, with the help of this midday meal, the children are coming for the admissions in school, they are attending in the school, and they are completing at least the primary education in the school. That means various students has been seen as dropouts, and most of them not completing the primary education. So with the help of this midday meal school, this can be improved. Then under this program, children are provided the lunch meals, skim milk, the fruits like bananas, or the rice and everything is being provided during the midday. Next we'll move to the guidelines. The guidelines under this program are that the supplementation, not substitution. What's that mean? That means the meals should have a good supplement. It should be supplementary, and it shouldn't be as an option. It shouldn't be as a substitute from the home diet. It should be according to the nutritional needs of the child. It should be according to the the findings of the child health, findings of the health of the child. So it shouldn't be a substitute or an option. Then the next guideline is that means the at least one third of energy requirement should be provided under this meal, as well as one half of the total protein is to be provided according to the requirements, according to the the needs of the child. Then the diet which is to be included, it should be low cost diet and it shouldn't have a high price. And next is that means the food should be locally available. It should be like it shouldn't have a bad access of the people towards this meal, or they should have an easily it should be cost less in the cost to for that means to have an access easily towards such kind of foods. And it should be prepared in an easy way. Easily preparation should be there for the foods which are used in the midday meal. Then adding foods frequently, that means change of the menu should be there. And if you are giving a food in a day, it shouldn't be repeated tomorrow. So the menu should be changed frequently, or we can say the time by time, to attract the children towards the food and to enjoy the meals. Then the nutrition should be adding as a subject in the curriculum to motivate the young minds, and they will be having a positive attitude or good concepts of the nutrition for their better health. So under this program, this nutrition subject is to be implemented for the students, for the children in a primary education as well. And the last one is like it has been seen that 70 million children has been benefited, and they have been benefited under this program with the help of the this one nutritional programs. These children are growing in a good way. They are having a positive the attitude contribution towards the health of this country, right? Fine. At last, I'll be mentioning after finishing all these the nutrition programs, the main role of a nurse is very important again, because the nurse has been she is having a vital role wherever she is, either in the community, either in the hospital, either in kind of society. She has a vital and the basic role, important role everywhere. What can be the role of nurse? Especially it's the nutritional education. It's the education regarding the diseases due to the nutritional deficiencies, right? So the nurse has to give the awareness among the people, among the target people, among the areas where the deficiencies is being found. So she can have a communication with the people, and she can give the information related to the deficiencies and related to the prevention of diseases, right? And also the distribution of folic acid, distribution of the supplements under all these programs, monitoring the the implementation of the services, as well as helping or assisting them in accessing the services, and other many more services under these programs are to be monitored, observed by the nurses. And she is having a main role, like if she provides education to the people, it will be much helpful, right? Okay, so I'll be concluding this today's session on some of the sentences, like what are all the things we have seen today under the nutritional programs. Such kind of programs which I mentioned, like special nutrition program, integrated child development services scheme, then Balwadi nutrition program, then midday meal program, then the other programs which I mentioned. So these all programs are coming under the nutritional programs, right? Hope you enjoyed the topic and hope it's helpful. Thank you and see you in the next session.